All right, we're going to get started. Good afternoon. My name is Marian Kromkowski, and I am the president of the League of Women Voters of Leelanau County. The League of Women Voters is a nonpartisan but political organization that encourages informed and active participation in government. We try to work to increase understanding of major public policy issues, and we attempt to influence public policy when we can through education and advocacy. We never ever support or oppose candidates or political parties. Men and women over the age of 18 or over who are U.S. citizens are welcome to join the League. The League currently has approximately 131 members, 30% of which are men. Dues are $60 a year or $90 a year for a household. Membership applications can be found online at LWVLC.org, or we have brochures at the entranceway, plus additional information on the two tables at the side of the room. Today we host the forum entitled Towards an Age-Friendly Leelanau. The League of Women Voters Age-Friendly Leelanau Committee has been studying elements of age-friendly communities and reviewing how Leelanau County is doing with respect to these aspects. Phil Meixel is the chair of the committee, and he will introduce the program and report on community support. Trudy Galla will report on housing, and she's the director of county planning, the county planning department. Mary Tannenberger will report on transportation, Chris Palmer on healthcare, and April Messias, the Leelanau County Director of Senior Services, will report on what some other communities have done. At the conclusion of their presentation, there will be question and answer, and we will walk around with the microphone. And after the forum and question and answers are done, we'll take a very short break, and then we'll have our League business meeting. Members are encouraged to stay. Non-members are encouraged to stay and observe. And with that, I'm going to hand the microphone over to Phil Meixel. Thank you.
Thank you. Nice to see you all. As Marian said, I'm the chair of the committee. Can you hear me all right? All right, that's better? That's better, yeah, I can hear. Some of you may remember that in 2014-15, there was a committee on, I can never remember the name of it exactly, the opportunities and challenges of a changing Leelanau. And we really just looked at the demography and some of the changes going on in the county and talked about that. And one of the things that was very striking to us at that time was the very high proportion of seniors, older people living in the county. By the way, one of the real challenges for the committee has been to navigate what are the appropriate terms to use for older people today. So I don't want to offend anybody in the room anyway, but it turns out that as you get into this, it's more complicated than you might have thought. So one of the things that we discovered was that there were lots of seniors living here. And so the committee, as we finished up with that first round, said, should we continue to work? And if so, what would it be on? And several people in the committee said, this is really, shouldn't be news to us, but it really is striking in the composition of the county's population, and we ought to look explicitly at that. So that's what we've begun this year. And this year's work has really been to try to get enough understanding of the topic to be sensible. It's a huge topic, as you can imagine, and so we've been trying to come to terms with what it might mean, what might be involved in that, and we've talked with a number of people, and then we've begun to try to collect information on the situation in the county. So today's report is an interim report, and we would hope in another year going forward, if we do that, to move toward trying to consider more what measures might we take if there are areas that we identify that we think need some attention in our view, then we might think about how, if at all, to address those measures. So our model or our format is a little bit like let's look at what is the ideal. And there are, as April will talk about a little bit, and as I will mention, there are a number of agencies around and organizations from the UN's, from the United Nations, various agencies to the state of Michigan, which have put together benchmarks, indices, various measures for what constitutes an age-friendly community. So we've looked at that and talked with people, and we've selected from what are oftentimes long lists, the 4 areas. Actually, there's another area that I didn't put down for Marion, so I'll be talking about that at the very end on the idea of a supportive community. But we'll be looking at those categories, and people today will be reporting on what we've found so far about the circumstances in Leelanau County. And then if we go forward, why, as I say, we'll try to see what if any gaps we might wish to close or try to close. So I'm going to get us started. I'm a big believer in evidence, in data-based analysis. So I took some time and put together, and for some of you this will not be news, for others it may be a bit more news, on the kind of to what extent Leelanau County is characterized by a significantly large senior population and a rural character. So let me hand out some material now and talk about it for a minute. I think there are about enough to go around, but I might ask couples to share a little bit. So among its other noteworthy characteristics, well, again, if you can share, please share. Hope they'll go around. But let me just go down, starting with selected population characteristics for Leelanau County. Notice that from 1990 to 2010, the proportion of the population under 20 years and under 35 years has shrunk. Population at the other end has grown as a proportion. Should not be a huge surprise, but there you are. You can find your township and find out the proportion of older people in your township in Table B. And then we went a little wider and could show that we're part of a feature. The graying is a feature of northwestern Michigan, though Leelanau County seems to grow even there. And you find that between 2000 and 2010, the population from 25 to 44 has in general shrunk. All right, those are negative. It's negative. Leelanau County, that population group has actually shrunk in size, whereas the population above 65 has been the part of the population that has grown. Turning to the second page, I found recently some population that's focused on households, well, on population, and it's a little different from the earlier population in that it has actual numbers. And I focused just on the population over on the left-hand column, that out of a county population of 21,793, 7,770 or 36%, are over 60 years of age. And I didn't figure the percentages for the others, but you can divide through and get that. The other interesting piece of information I thought was on households. And so if there are 90, just over 9,000 households in Leelanau County. And of those households, households with one or more person 65 years of age and over are 40% of households, or 3,633. Households with a person 65 years of age and older living alone are 12% of households. And I put down there at the end, on the other hand, look at this, households with one or more persons under 18 are only 21%. So that's partly what you see on the other side in the diminishing, kind of shrinking population of younger people. But anyway, so that's where we are. Those are the lemons. Now, what do we make of it? Anyway, is the issue. But in case, I mean, as I say, it shouldn't come as a shock, but I think it's kind of interesting to see the information down in front of us. The other feature then of Leelanau County, okay, so one feature is that there's a high proportion of the population is older. The other feature that makes it interesting is that it's very rural. So I put on this map down here, and you see on the map, the particulars don't matter, but you'll notice down at the base of Grand Traverse Bay is Traverse City and Grand Traverse County, or at least the portion of it below the bay. That's the only portion, other than towns and villages, in our area that's very densely populated. Notice that in Leelanau County, I mean, except for the coastline counties and the counties down, or the townships down near Traverse City, we're very lightly populated. Again, that shouldn't come as a big surprise, but I think it's interesting to see it out in front of us. And so it seems to me, to get us started, that what struck the committee as, shall we say, interesting was the presence of the two factors. On the one hand, a large and growing population of older people, and on the other hand, this rural character. And together, I think those make a real challenging feature. Many of the studies that we came across and the efforts to make recommendations for making communities senior age friendly and all of that had to do with urban areas with very dense population. So you need to have nice sidewalks and you need to this, that, and the other. But we thought about it, and those, for better or worse, are not particularly helpful for us here. So I think Leelanau County does present an interesting kind of, shall I say, problem, or an interesting situation for people interested in the quality of life for seniors, and that is a high proportion of the population, but spread out over the whole county and without the density that might make certain kinds of services and activities easier to do. All right, I'll close with that kind of introduction and say that what we did then was to go forward, and we decided, again, we selected these areas to focus on, and I'm going to just, without, Marion has introduced the speakers, so I'm just going to pass the microphone on to Trudy.
Okay, thank you, Phil, and thank you everyone for inviting me here today. Phil actually kind of leads into what I'm going to talk about. First off, he mentioned what is the appropriate term to use. So we think of that sometimes with housing. We talk about affordable housing, but many people do not like the term affordable. And when we talk about housing, you know, the word affordable doesn't always relate to exactly what we're discussing. And so I will use the term housing today, and I'll use the term seniors, and I hope that that is appropriate. So we talk about age-friendly Leelanau, and we are talking about a graying community, and these are some of the statistics that I pulled up, and Phil's already mentioned these, is, just a recap from 2000 to 2010, the individuals in our county over the age of 55 are increasing at a much higher rate than we've seen in many, many years, probably since this county was established. And the lower populations, the 35 to 44 and below that, we're seeing decrease in the percent of population. This is really a change because from 1990 to 2000, we had about a 30% increase in our population. And from 2000 to 2010, we only saw about a 3% increase overall in our population in the county. And for the first time ever, we actually had a community which had a decrease in population. So the demographics in the county are definitely changing. With that aging senior population, we see some demands. There's more demands on housing, where are seniors going to live? The home that they're in right now, does it fit for them? Is it going to meet their needs? Also, what about the design of the housing? Does it meet the aging and the health issues? I have a relative right now who is facing some issues with their legs, with problems with their legs, and just getting up and down some of the steps in our home as well as some other relatives' homes is really a problem, and they are in their 50s. So, we need to look at the design of our homes as well. And then we also look at the demands on the local services such as public transportation and accessibility. Not only the accessibility of the home that the person is in, but what about if they want to go visit someone, a relative or a friend? Can they get into that home? Can they maneuver? Are the bathroom facilities set up so that if they're in a walker or in a wheelchair, they're able to visit a friend and be able to use the facilities? And then also the accessibility in our businesses and our communities. Can you get in and out of businesses to shop? What about on the sidewalks? Phil mentioned that, are the sidewalks in good condition? Are they cracked? Are they uneven? Are you able to get from the sidewalk and cross the streets and get into another business? And then there's the increased demand for services like public health, senior services, cleaning, yard work, and emergency services. When we talk about housing, Leelanau has the highest housing costs within our 10-county region, and I've listed the 10 counties here that make up Northwest Michigan. The median household income, so that's the middle point, is $62,162 annually. The median home value in the county is just over $241,000. So when we look at what an average family can afford, if they're at that $62,162 or somewhere close to that, what they can afford is a home of about $155,000, and yet we're looking at a gap here of over $86,000 between what they can afford and what that median level is. So below that, what is on the market, you're really struggling to find something, and I'm sure we can all relate stories of people we know who are trying to find homes in that lower amount and can't do it. And then the challenges we face with our housing is our regulations. They differ from community to community. We have 11 townships, 3 villages, as well as the city of Traverse City, which extends out into Leelanau County, and all of them have their own zoning regulations. And that affects the size of the homes, the size of the lots, whether accessory dwelling units are allowed on the property or not. And then if the accessory dwelling units are allowed, how are they used? Are they used for what we term a granny flat, where grandma and grandpa are living there, or perhaps even a college student who has graduated may be back home with the parents and living in an apartment above the garage or a separate unit on the home or on the property? Or are these properties rented out? And when we get into those discussions, we have to look at the assessment, because assessors look at these and have to determine whether you get a homestead exemption or a non-homestead exemption. So we run into difficulties there with what's allowed with zoning versus how it's going to be taxed. And then, of course, when we look at housing, we have other issues like the cost of purchasing that property, the taxes on the property, the construction of the home, and so forth. And again, accessibility, which I already mentioned, and then the location. Where is it in the county that we should be looking for identifying good locations for housing for the future? Housing that would fit all generations, not just seniors. And when you look at the rural area, we may be dealing with seniors who have been in homes for quite a long time and want to stay there. But then what are their difficulties? Do they have access to transportation, such as Beta? Do they have neighbors that can help them out in the case of emergencies? They're away from walkability that you would see in a community like your villages and your towns. And so they don't have access to recreational opportunities like you might have in the village of Sutton's Bay, where you can go down to a park, you can go to the water, you can see kids, you can walk on trails and so forth. So location of these homes, not only for seniors, but for all ages, is also very important. And a little bit more on the challenges. That is a light chart there, but I'll go through a little bit for you. There's also a lack of year-round rentals, which limits downsizing for seniors. And I think April has a lot of information on this. Seniors who are in their home now, maybe they're widowed, kids have moved away, they have this big home, taking care of it, and the utilities in the yard is just too much. They want to downsize but stay near their community, but what's available? And we find that year-round rentals as well as smaller homes, there's really not a lot on the market. And then, of course, the lack of housing stock available to those who are below that area median income, particularly below 80%. So if you are a single person in your home, the area median income would be $48,400. If you're making that much a year, you're making the area median income. If you are below $38,750, you're below the 80% area median income. And we see a lot of individuals that fall below what we call the low income, 50%, which would be $24,200 a year for one person, or even the very low income at 30%, below $14,550. And you know, this chart, I show this because a lot of times people don't realize that they themselves may fall into this chart. And they look at those and they realize, wow, those numbers are higher than what I expected. So when we go to a family of four, if they're making below $55,300, they're below 80% of area median income. And keep in mind that I said that area median income was over $60,000. So a family of four, if they're not making that amount, you know, they're below that area. They're below the 80% area median income. So age-friendly, if we want to be an age-friendly community, what can we do? Well, we can look at different things like review of zoning codes in our communities, and this is something that planners and zoning administrators can do. It's something our department can do. Are there changes that we can make in the codes that would allow more housing choices, such as the accessory dwelling units, apartments, apartments? If you haven't heard that term before, it's being used on the West Coast for very small apartments, very efficient apartments, where just about every square foot in that place is used for something, storage, small appliances, and so forth. Or even multiple units, duplexes, fourplexes. Can we do some changes that would allow for smaller lots in our zoning requirements and smaller homes, as well as higher density near villages and towns? When we talk about higher densities, we get into the issue of most areas need public water or sewer, and out here we're a rural community, so we're kind of limited on that as well. Accessibility, I mentioned this before, and I'll give you an example on this, but this could be something that could actually be a school project that could be taken on to identify the accessibilities in our communities. And multi-generational development, we had a speaker here from the East Coast last year, Esther Greenhouse, who talks a lot about multi-generational development, looking at the rehab as well as new construction. How do you address the design of the structure? That can be done through planning, through contractors, through developers, but also the layout of the homes. And April and I were talking about this the other day, is not only how is the home designed with the electrical outlets in a place where you can easily get to them, or lower cupboards and so forth, but what about just the design of the furniture? If a person is in the home by themselves and drops their cell phone behind the couch or something, you know, if they can't move that couch, can they get that phone? So just the design and how the furniture and everything is arranged in the house is very important for accessibility. And then finally, spread the word. If we're going to be an age-friendly community, or we're trying to get there, we can use social media. That's a really strong tool. So we can use social media to spread the word and then also gather new ideas. So this is a term that I like to use in my office, that every problem is an opportunity. So we have some challenges. We have some challenges to develop an age-friendly community. And a very good county administrator years ago told me, start with small successes. You can't chew off the whole thing and try to come up with a big plan. Start with small successes and build on those. So I did an online search and tried to find some examples. And I happened on the World Health Organization, and they have age-friendly practices where you can do a search, and you can search any country, you can search all countries, You can search the size of the community that you're looking for, and then you can search the domain. You can search housing, you can search transportation, and so forth, and you will get examples of what other communities have done. You can even enter your own examples on here. So if Leelanau County starts out and does some great examples, we could add them on there. So I pulled out two just for a quick example for you of something I thought we could start with, which would address that every problem is an opportunity. Here is one from the state of Maine. And what they did is they have an action plan that says their goal is to increase the availability of information about simple changes in appliances in the home and the car. And so they have what's called a tool table, which is set out, and it has all kinds of different devices and tools that seniors can come and use and sample before they buy them. And I thought this could be something maybe senior services could even do, because they have different types of pillboxes, jar openers, can openers, doorbells, stretchable shoelaces, devices to get in and out of the car easier, and so forth. And this could be something that could be implemented very easily, probably at a low cost. What they found out is that it has been very popular for residents of all ages to come in and check it out. And they found that something as simple as a can opener can change the life not only of a senior, but of a mom who's holding a toddler or a baby and is trying to get dinner ready. So there's an example of something that's multi-generational. And then the next one I really liked, and I was hoping maybe we could get high school students to do this, especially many of them have to do senior projects. This is from Canada, and they wanted to increase the awareness among the youth and the local businesses about the challenges facing older adults. And so they took these kids and they videotaped everything. Some of them used walkers, canes, some of them were in wheelchairs and other people pushed them. Some of them had dark glasses on as if they had impaired vision. And they took them out into the businesses and they filmed it. And then later the kids had to do a debriefing and they did a report and they shared the video on everything they learned. From there, they were able to identify that only one store in the town had automatic doors. Nobody else did. They were able to apply for some funding and install a lift in that building, and they've been giving the report out to businesses and encouraging to make changes to get accessibility so people of all ages, anyone that has some kind of a physical disability, can shop in their store. And I thought this would be something that would be very interesting to do in Leelanau County. We could just pick a couple of villages or towns and see how that would work out, as well as maybe even going into some individuals' homes if they would like to volunteer and find what the difficulties were. And so with that, I will end with one other thing. In September, the County Planning Commission has identified their topic for their annual planning session, and it's going to be small homes. So we are going to bring in speakers. We're looking for perhaps national speakers that come in and talk about the advantages and the challenges of small homes and where you would locate them in the county, how they would be constructed, and how they could work in our communities. And I will give you more information on that as we get closer to that and watch the county's website. I hope you can attend. Thank you. Not sure how you get to the next one.
You just push this out.
Okay,
Push this
just that.
Yep.
Thank you, Ty. I appreciate an expert doing this because as a former teacher, I always hesitated to do audio-visual. Always had somebody else at my elbow. Welcome this afternoon. My topic is transportation, and it's been an interesting exploration as our committee has met. But these are some of the key issues, and I'm sure most of you are aware of some or all of them. But transportation for seniors is an absolute key element for living independently. In this region 10, and Bob Schluter, who heads up the AAA of Northern Michigan, is here this afternoon. We heard reported there are 1,500 requests per day for transportation in our region. That's a lot of people needing help. As we heard previously, Leelanau County is a rural county with major medical support in Traverse City.
So from Northport to Traverse City, we're talking half hour to 45 minutes. Limited public transportation, and I'll get into that in just a minute. We found an aging population, as we know, often declines in driving capabilities. And the AARP has a focus. You can retrain yourself, go online, take a self-administered test, or there are classes offered in this. And I checked with the state of Michigan, and Michigan may be is considering retesting those 75 years and older for a driver's license. Now, that's only being discussed at the state legislature. It would be very controversial. But an eye check is required for all residents every 8 years. And there's one error on this slide. If anyone is involved in 3, not 1, but 3 at-fault accidents in a 2-year period, that person is required to complete a road test. And I think we can understand that situation. Okay, our local options. Local options, Beta is our main public transportation system here, and it offers limited bus service to and from Traverse City. Route 10 goes from Northport, Suttons Bay, and Elmwood Township, north and south. Route 11 goes east and west, Maple City, Burdickville, Glen Arbor, and Empire. Some routes are in jeopardy in continuing due to lack of ridership. A number of our committee members, we had the new director of Beta out here, and she's working on rethinking service to our county, because Beta has to be certainly cost effective, and our ridership is not where, of course, they'd like it to be. And I don't know, let me see a show of hands. How many have ever ridden on a Beta route? Just a show of hands. Okay. It's not even half in this audience, but many units are not senior friendly. You can imagine, you just heard Trudy mention getting around one's own home up and down stairs. Well, Beta is not that easy to use if you have any kind of disability. There's the transfer station in Traverse City for connecting service to shopping and healthcare offices in the hospital. And there is a link service that can pick you up at the home, but if you go on the Beta website, you'll see they drop you at the closest stop to your home where you wait, and you've seen some of the Beta waiting stations to wait for the next regular bus that is coming along. So you have to know what time you will be picked up by the connecting bus. Okay, other local options. Cab service. I made a calls to a number of cab companies and found that while we have more than one cab service, the rates are high. And I just threw these on the slide here. Chippewa offers van services with a lift. The charge is $5 to load and $5 to unload, plus $3 a mile. Chippewa's regular taxi is $3 a mile. To and from Lake Leelanau to Munson is $60 each way. I'm not advertising any of these. They're probably not going to get a lot of ridership. Cherry Capital Cab has no lift service. The regular taxi is $70 each way to and from Lake Leelanau. I use the Binsville building as a center point in the county because a number of you live north of there. And the Northern Michigan Medical Service is a specialized taxi service, $65 each way to and from Lake Leelanau to Munson. Munson Transportation Services, I've put the 800 number up here. It's a brand new service that Munson is developing. And within a 60-mile radius of Munson, 2 wheelchair vans with certified Munson employees are available. It needs to be pre-scheduled. It's $45 for up to 2 hours of time in that van, and $21 per hour over the minimum of 2 hours. If you're discharged from Munson or a local skilled nursing facility, this is what they are trying to design this service for, but also transport to and from medical and non-medical appointments. Assistance with outpatient procedures where personnel are required to stay with the patient. For example, I think Copper Ridge has a number of procedures where they require somebody to be there in the lobby while the procedure is going on. So that Munson service is designed to help people who need that if they don't have a friend, a neighbor, a relative to sit there with them. But they also, interestingly enough, if you were going to a doctor in Traverse City and needed to make extra stops on your way home, such as at a pharmacy or a bank, they allow that. And the driver would also come into the home and do some oversight of the home situation, whether the heat was on, whether there's food in the refrigerator, those kinds of services. And obviously there is an hourly charge for that, but it's a new service they are just initiating. Okay, volunteer options. Number of volunteer options in this county. Share Care is a private membership organization. A number of you in the audience are members of Share Care, but it has volunteer drivers. It works driver of the day. Deb Weatherby over in our audience, she schedules drivers of the day. So if a person needs to go to the doctor or into Munson, that person will be volunteering to help the member. It provides door-to-door support for medical appointments, personal appointments such as beauty parlors, barbershops, banking. Senior Services, headed up by April, has non-emergency medical appointment drivers, 1 per week for a person who is a senior in this county, but at this point in time, there's no wheelchair support. And as we all know, churches offer support and neighbors and family members when they are available. And many people, of course, are here in this county, but their children or other relatives are not in this county. They're downstate, other states. So that's a consideration for us all. Okay, these were a little interesting brainstorming that we did. Someone thought perhaps an Uber or Lyft type service could be developed for the county. Not by the county, but private companies that might have an interest in serving our county. Beta is examining development of more personalized service, coordination of the demand request with door-to-door service, and potentially refocusing themselves as a transportation agency, not necessarily just a bus agency. Senior Services could offer vouchers for transportation services. This, if Beta obviously comes up with some added services, we could collaborate with them through Senior Services. We all know we've been reading about self-driving cars. In fact, in the legislature, they're trying to be way ahead of the game. They're considering legislation about all the insurance issues with self-driving cars, the liability, et cetera, if a car fails in any way, shape, or form with its design. But your legislature is thinking about this as we speak. And I met a gentleman from Benzie County who's on the Michigan Association for Counties Transportation Group, and he said that Medicare reimbursement for transportation is on the horizon. Medicare, of course, has billing capabilities, and a recent White House conference was examining this whole issue of transportation tied in with Medicare. So I thank you for your time. I just have to give a little plug in the audience. We have a number of BASA members. That's your regional Bay Area Senior Advocacy Group. Comfort Keepers is here. The Pavilion's representative is here. Another representative or two in the back. But we have about 80 agencies in this Grand Traverse Leelanau County region that are serving seniors. So go on the website. Pardon? Oh. Go on the BASA website and you can scroll down to see the various agencies. Thank you. Thank you, Ty.
Now, I want to show you, you don't need me here, right here, we have this. When you want to go to the slide, you just push this arrow button. Here.
Good afternoon. As we age, it becomes necessary that we have access to quality health care, and as have we definitely heard this afternoon, this is becoming an increasing priority for Leelanau County as the percent of our seniors continues to rise dramatically. Quality health care can be defined as adequate, available, and affordable. Leelanau County does have a variety of services. Some of those are fee-based, and some of those are gained through community or volunteer services. Doctor services are available in Suttons Bay, Northport, and Traverse City. The only physician's office open on Friday is the Cherry Bend Family Practice. Leelanau Urgent Care in Suttons Bay is open Monday through Friday, 8 a.m. to 4 p.m. So what is the message here? No wild weekends. You probably won't get your doctor after 4 o'clock or after, perhaps even after, on Friday, and after 4 o'clock you can't get urgent care. Complete hospital services, of course, are located in Traverse City. Home care services are a very important part of creating an age-friendly community. It also can be very problematic. Seniors wanting to remain at home face a variety of challenges: appropriate housing, transportation, and provision of personal services. When available, home care services generally cost about $20 an hour. So if you just figure that out for a 8-hour day or even a 4-hour day, 1 day a week, you're looking at a significant amount of money. Sometimes home care providers are not willing to go to rural, remote areas, even if financial services are available to pay for that. Leelanau County Senior Services offers a variety of health care related services, including respite care, personal care, medication management, and emergency pendants. However, related services such as, oftentimes those services need to be supplemented by private pay, and many seniors that live on a fixed income are struggling just to make ends meet, let alone pay for the extra care that's needed. Share Care was mentioned already, and it does provide a great variety of personal or professional and volunteer services to assist seniors to remain in their home. However, it is a membership organization, and it is not feasibly, financially responsible for many residents. Another service is chronic care management, which does do home visits and does not require a doctor's referral. However, they do work with doctors and they do handle the insurance billing for you. A variety of private agencies, and I heard there are some in the room today, do provide home care services. A good way to help locate services is to contact the Leelanau County Senior Services for referrals and assistance. Some of these are private agencies that I mentioned, and also some private individuals, and Share Care does have some private individuals that they can refer to as well. We are hoping today, I learned of one new agency already today that isn't available yet, but that's being developed by Munson called PACE, that is for people that would be available or appropriate for nursing homes but want to remain in their home, and it's going to be a comprehensive service to help them do that. I think there are services today that we haven't necessarily covered, and there are some index cards on your table. So if you are a person that is a provider of those services and you're here today, or you just know of some other service that you're using, please fill out one of those cards and you can just place them on the table afterwards. That could be in terms of transportation or housing as well, because we want to make sure we have a comprehensive amount of those. Another service that's provided are by EMTs. They will do wellness checks and blood pressure checks. There is some work in progress to get their ratings up so that hopefully they will be available to provide more help. And that would really be a great thing for the county if that happens. One of the biggest problems that is expressed both by EMTs and other healthcare professionals is that people don't ask for help. They're very reluctant to ask for help, and I bet there's some people in this room that have been in that situation. And they are requesting, please do, that's their job, that's their expertise, so don't hesitate. They'd rather that you called and were not needed, so keep that in mind. Local churches, as was mentioned, often offer assistance in providing respite or in giving drive to different appointments. The need for more volunteers to do the driving is a critical need that has been expressed by many as well. Some churches have health ministries, and I don't know if any of you noticed recently, but St. Mary's Church just did a healthcare fair of rural healthcare services in the county. So that was something that just happened. All the pieces that we're talking about today are transportation and housing and healthcare and community assistance, all piggyback on one another. And as this population of baby boomers continues to age and more seniors come to the county, this is only going to be more, something that needs to increase. So we request, or we are glad to get your input and help in this matter. Please do assist us in giving any information that we haven't provided here today. And thanks. So, April?
This yours?
Yes.
Just push that.
Okay. Good afternoon. So this is obviously something that's close to my heart, and as I'm providing services for seniors in the county, and I'm out and about visiting our different communities, and one thing that struck me is early on is as I started my position is the percentage of seniors that we have in the county, 38%. That is one of the largest percentages across the country, across the nation, and that, I don't know, that just weighs on my heart all the time. Across the nation, we have one of the largest percentages. Maybe not the total population, the greatest population, but the percentage. And so we heard earlier about that percentage of seniors compared to younger adults and the impact that will have and is having on our county. And so as our group got together and we're talking, we began like, well, where do we begin? It was kind of overwhelming as we're talking about concerns and what's happening around the county. And so we started with sometimes a sharing of stories and things that we knew that were occurring. So some of the challenges that we hear throughout definitely were the housing, and Trudy touched on a lot of those. And I, working firsthand with seniors, have known their challenges they have, and if they have a larger home and they're wanting to downsize, but it's very important to stay in the community to maintain those connections to their family and their friends. And so how do they do it? The questions regarding that. Where do they go? What do they do? And not wanting to have to move to Traverse City to have their needs met. The transportation for medical, we heard a lot, there's transportation services for medical appointments, but another big one is transportation getting to and from the grocery store, accessing fresh fruits and vegetables, or transportation to local events in the community, staying connected with the community and their friends and their neighbors, and what happens when you can no longer get yourself there, if you're no longer able to drive or you don't have access to somebody who can take you. So just how do we keep people engaged? So some of those challenges that many of our seniors are facing. So then the next question was, okay, so we want to talk about age-friendly, oh, sorry. There, oh, what did I just do? Oh, it skipped one. Weird. Okay, I'm missing a slide for some reason there. I'll just talk, so sorry. So the next question we had was, okay, so we want to have an age-friendly community. What is an age-friendly Leelanau County? What would we need to meet that? And what would that look like in comparison to other communities? So we were looking for examples and, tossing out ideas of different communities we were aware of across the nation. So then we went back to the ARP age-friendly community. And the network that they've designed, and they're affiliated with the World Health Organization, Age-Friendly Cities and Communities, and the initiative started with preparing for the projected number of people who will be making up our population as they age, as in comparison to the trend of urbanization, or people being forced to move to areas where they can access transportation and goods and services and not be as isolated like in a rural area. So they have a livability index that they looked at, looking at outdoor spaces and buildings, transportation, housing, social participation, respect and social inclusion, communication information, community health services. And so we pulled off the assessment offline, and it's like this thick and very in-depth, and we're like, how do we go about assessing our community to find out where we're at in that respect? So out of that came the idea of pulling together and looking at the housing, the transportation, and the health services. But it was interesting in pulling that information off, realizing that there was a list of age-friendly communities that had received that designation across the country, and many of them were the urban areas. And I kept looking and looking for like a county, because we're a county here. We have just villages, so we could go. Most communities go for an age-friendly city or area, but how to decide which would we choose? Do we choose Suttons Bay? Do we choose Leland? How do we assess that? So we wanted to look at the whole county, and let's see if I can. Okay, so referencing Michigan, there were only 3 communities in Michigan, but they're very urban areas. Auburn Hills, Highland Park, and Lansing. Very different than our community here.
April?
Yes.
Actually, Traverse City and Bel Air also
Are they age-friendly? Okay, so it didn't show up today at all. Okay.
Manistee County is going after it, so that's a
The
possibility for you.
Community for a Lifetime, that's the Michigan Community for a Lifetime. So then there was the designation of the Michigan Community for a Lifetime, and they had 10 topics of what they would define as an age-friendly community for Michigan. And Bob is correct. So there are 25 communities here, including Traverse City, and I know that Manistee is looking to apply for that as well. And it was very exciting to see 7 of those 25 were counties. So that was exciting to know that there were entire counties that were going for this designation. So, I think age-friendly communities is that idea of trying to support people in staying in their homes, remaining independent, and living life on their terms, and really encouraging people to advocate for those changes so that they're not forced to make decisions and leaving their communities and going and doing things so that their community meets their needs. So the big question is, how do we translate that to the rural area? And very different, urban versus rural, and the challenges that we face in meeting those needs of seniors. So one of the things we looked at or discussed that came up a lot was aging in place and supportive services. Obviously, housing and transportation fall in that line as well, but what are some other models in supporting seniors? So there are the Commission on Aging Senior Services, and so in the county we have senior services that provides a number of support and for seniors to remain in their home. And then the area agency is on the larger side, continues to promoting well-being and old adults, providing services and programs to help them live as well independently. So then we came to the idea of talking about there's other models in rural areas and what is working. And Larry Copper brought up the village model and a self-governing grassroots type membership organization that coordinates and consolidates services, promoting volunteerism and civic engagement and connecting with intergenerations. So some of the examples, Shared Care of Leelanau is a village. It's the village model. So they provide a number of supports to seniors here in the county, in addition to senior services as well in the area agency, doing assessments, healthcare coordination with Ann Kelly, the nurse, promoting volunteerism with Deb, and educational programs to keep people active. Another program that came up was Minnesota's Living at Home Block Nurse Program. And that was another type of village model, but it was a 501c3 that was providing volunteer supports and services through volunteerism, people in the community that were maybe assisting with yard care, lawn care, maybe making a meal, helping with transportation. But they were also connected with an organization that was working, coordinating professional services as well. So looking at, some people may need more, maybe personal care, respite care, or med management, those kind of professional services. So they had one person that was working with both organizations, coordinating so that there would be no gaps, there wouldn't be an overlap of services as well. So meeting looking at that holistic needs of that person and what they may need. So that was another model looking at how to meet the growing needs in a rural area. So the question of what does an age-friendly Leelanau County look like? Yeah. And I think, we think the big picture, like how do we make this an age-friendly? Because then when we look at all the pieces that have to go involved in that, all the housing, the transportation, and where do you begin? And recognizing though that Leelanau County, I keep looking all the time for a model of like, let's find a community exactly like Leelanau County that's, and find out how they're doing it so we can copy that. But recognizing that we are a very unique community. We have different culture than other communities. So how do we honor our community, our culture, everything that is wonderful that we love about Leelanau County and create it a place where everybody, where it's age-friendly, supporting seniors, and recognizing that when we're supporting seniors, we're supporting all ages. When you build a community that's age-friendly, that's for everybody of all ages. So I think we're in an exciting time, and that we could be charging the way and showing the nation another way of how do we create an age-friendly community here.
So there you are, nothing to it, right? How much time can we squeeze out of?
1:25.
Oh, we've got time then.
15, 20 minutes.
Okay,
There's
good.
a lot of questions.
Sure, I'm sure there are. Before we open the floor to questions, let me just encourage you again, if any of you out there listening would like to be involved in this enterprise going forward, we can always use more help. And as you can see, it's still kind of early days, as we say. We've got a lot of work to do. It's taken us a good bit of time to do it, but we're gonna try to march on and come up with some, as I say, some measures. I use measures because I'm not quite sure what they would be. And to finish up on April's point, I think what we have to try to aim for is something that's appropriate for us here and for the people living here and for Leelanau County. We don't want to try to just import something and impose it or force it on the county. So we'll see. I think what you've seen today are some of the pieces that we've discovered and that we're perhaps working with, but we need to go forward and try to make a little more sense out of those in a more programmatic way. Anyway, I'll end with that. If anybody has any good ideas or questions, we'd be delighted to hear them. Sure.
I have a question.
Sure.
Yeah, I'm going to borrow the microphone if you can
Oh,
use that
okay.
hand.
Sure. If you have it, tune in. Go ahead.
And you have another mic over there for whoever's going to answer the question.
Okay. There's the mic over here.
Hi, you hear me okay? I have a question about Well, first of all, I'm impressed with what you've accomplished, the research, and I'm also impressed with having about 80 different agencies in the area providing services already. I'm not sure how much more you can do, but trying to make things better, I'm a bit curious about the size of the problem. There's 7,770 people over the age of 60. And I would imagine that there's only a percentage of those that need help. So I don't know what we're trying to target. I think targeting 8,000 people is not our target. The target is a subset of that, people who don't have enough money, don't have friends, don't have family, don't have the resources to care for themselves. But in hearing all the different issues that you're targeting, it seems like you're largely looking at trying to provide services to people in place. And I don't see that as realistic. I think as we get older and we don't have the resources, the family, the friends, and the money and whatnot, you have to find a location, urban areas that were pointed out, that people need to move to. Trying to provide services to everybody in every location is not going to happen. So I think we need to move the problem, the people, the older people, to the location where the services are. And I think those are urban areas. They're communities where people can live in a communal way, whether it's in an existing village, an existing town, assisted living, or whatever you want to label it. But I think you need to move the people who need the problem to where the services are rather than the other way around.
Comment on?
Great. Does anyone want to comment? April, do you want to?
I think that's the challenge in trying to create an age-friendly community and trying to put those supports in place so you're being proactive, educating seniors about what's available, how they can connect with community members. I think it's about that piece of creating volunteerism so you have communities helping each other and supporting each other, because you're right. I mean, it's very hard. It's going to be, there's the number of seniors and the number of people you're going to be caring for, there's not going to be enough people to do it. So it's being proactive and trying to put those things in place so that you can provide, so the people that would need the service down the road would have access and would be able to.
But that's my point. You need to find those places and target those places to make the improvements rather than trying to provide it in everybody's house.
A comment first on the first statement with regard to the demographics and the numbers. Keep in mind that you have those lower brackets, so 35 to 44-year-olds and so forth that are moving up. So as time goes by, those upper levels that you see, those numbers are going to continue to increase. We're not seeing that trend change at this point. So that upper number of over 55 will continue to increase. And we do talk about location. I mentioned it briefly, but that's one of the things is when we talk about housing, where and how many units and so forth. And that's important. There's a target market analysis that was done of Leelanau County. It identifies some locations and so forth, but that is a challenge for all communities is how many units, what type of units, and where should they go?
We're going to just go back and forth. Question on this side before I go back? Okay.
I have a question about driving issues. I have an 87-year-old mom, and for the past 3 winters, I think she has not driven during the winter. And after 2 of those winters, my siblings took her for a test drive, and she did okay. But this year, none of us want to take her for a test drive. And we're seeing some mild forms of dementia starting. So we presented to her, there are, a couple of maybe several driving schools or whatever have you that will do senior testing in the area. Well, anyway, my brother checked into them and he's located one that we want to use, but she dug in pretty hard about doing that. And so we have the keys to the car. And I just wonder if there's any, I know the opposition would be to mandatory testing, and that was her comment. The Secretary of State doesn't make me do that. I have my license, and So any suggestions, comments,
Maybe
where we could,
Right.
our society could go with this?
Well, let me answer that, because this is what the Secretary of State's office, I should use the
No,
letters.
it's not
this.
working.
Oh, it's not working. Okay, well, let me stand. From Lansing, they replied, if you have someone that you are concerned about driving, there is a form that can be completed, and the state will review the information. This can start a process for that person to be seen for a road test. I have attached the form for you. You probably thought it was me. If completed and you are related, the person cannot find out who turned in the form. It's anonymous. Anyway, that's, if you wanted somebody to be tested.
Did you have,
Do you have an answer to this?
Part of the answer, yeah.
Okay, yeah, I'm gonna receive that. We got a couple of hands here going.
I just went through the same thing with my mother. And what we did, one of the things I did is talk to the doctor. The doctor wrote out a prescription for her to take to the Secretary of State's office for those testings. The problem is forcing them to go beyond that because my mother threw it in the garbage. So that's another avenue you might want to pursue. I did talk to the Senior Citizens Center where she lives about that form which you're just talking about. But they never said that they would not disclose who turned it in, so. Yeah, they're gonna have a good idea.
Can I see a show of hands of how many more questions we're gonna have so I can kind of gauge? 1, 2, Ellie, 3? Okay. Thank you. Getting short on time, but go ahead.
Okay, been a resident for 20 years. Moved up here because I think it's a great place to retire, as well as many people, and that's why I say, why are older people moving up here? I think, I'm very proud of our county. I think it's doing an excellent job. I think Trudy does an excellent job. April does an excellent job. And I wrote down a number of things. You talked about areas for small housing, or smaller housing. I think one of our townships, and that's where it lies, in the township, Bingham has reduced their footprint for a house to 500 square feet. Regarding Mary Tonnenberg, transportation, I'm a member of ShareCare, okay? And ShareCare, I think, you talked about the cost of transportation. I think if you take, and it would be interesting, Bina, to do a study on it, how much it costs to be a member of ShareCare compared to what you would pay for transportation otherwise, okay? And I think it would be a major savings. I look at Leelanau Township as the oldest township, Phil. And
Glen Arbor?
you're the furthest from Traverse City.
Right.
Why did you guys move that far away? Okay, so that's the thing. I think many people, April, are not aware of all the services, the 80 agencies and all the things, the great things you're doing. Okay, and that's what we have to do is information. And I think also, lastly, if I may, the individual must be responsible for themselves to plan ahead for this. When I moved up here, I put certain things in my house so when I got older, which I am now, and I also found out something else, one other thing. I'm below the 50% in income. Anybody want to help me?
Need help? Give us a call. Let me say, this show here tonight, or this presentation, will be online, LWVLC.org, because it is being taped. Any comments with regard to Gary's comments? Before I go to the-
Communication is certainly one of the things that we found out about, and I didn't have a chance to talk about it before, but certainly the availability of information, a one number to call, kind of the ease of finding out was one of the things that we ran across along with transportation. So communication is very important, it would seem.
One last thing, if I may. I think we're in the right path for all of us. A little tweaking here and there.
We have time for two more questions, or, well, maybe if they're short, 3.
Just a couple of suggestions, one for Trudy and one for April. April, I think your office provides excellent services, but you're a long way from a lot of us in the county. It's more than 25 miles for us to come up here, so we really don't have a way to access those services. And I think if you partnered with some of our township clerks, you might have one day a week when somebody from your office would be available to help from Empire, from Northport, from Greilicville. That would be a good way to spread those services throughout the county. And for you, Trudy, this is a pet peeve I brought up at the Planning Commission years ago. I think we've got less than half of our houses covered by the green 911 signs. We still run into looking up addresses and can't find people. If we can't find them, neither can the EMTs. And I think the county or the townships, whichever is appropriate, should pass a mandatory ordinance that every single dwelling in this county be numbered with those green signs. Thank you.
We are, the time to talk afterwards, but, oh, okay, all right. Okay, all right.
I just have a really quick comment. I have a lot of ideas that I'll share with different committee members after we break up. As a person who lives in this community who does not have grandparents for my grandchildren, I think we make a very important misassumption when we assume that it's just about what seniors need. As a person raising children in this community, as a member of this community who's a director of a nonprofit who depends on volunteers, we need seniors in our community. So it isn't just a matter of putting people where it makes the most sense is to deliver services. We have a need to have people in our community who are older, who are elders, to be a rich community. And it's important to me to not lose that at whatever lengths we need to do that. Thank you.
Thank you.
Quick question. Is your group addressing the lack of population in the lower 2 categories you talked about? Are you trying to do anything to attract these kids back? Nothing. Okay, so you're focusing exclusively on the aging population. Okay. That's not an age-friendly approach, in my opinion.
Well, good point, Dar. I mean, we can barely handle what we're doing now, so that would be a great question.
Maybe the early childhood and age-friendly need to have a collaborative meeting.
Well, I mean, that would be both sides.
Committees on that. So one more question here, or comment?
One of the areas we didn't touch on that's very important that has come up is remaining engaged. And I didn't, we should have talked more about it, but you speak to that directly, and that is a very important piece. And anyway.
Okay, to piggyback on the last comment, I don't remember whether it was a year ago or 2 years ago, but there was reference made to another time you had a meeting like this, and you were talking about the importance of multi-generational communities. That one of the problems with an aging community is that we need the younger people. We need young families. We need opportunities for them to come back to the county, to work, places for them to live. They're needy in their absence. And you've already answered whether you're working on that. But I was under the assumption at that last meeting that this group was going to approach multi-generational communities rather than just aging communities. Can you address that, or say if that's just been thrown in the garbage, or if you have another group that's looking at, we need young people?
That's a whole other meeting.
Just speak
Okay,
real
I'll
loud.
just speak briefly to that. That is an issue that has been talked about before, not in this particular setting or with this particular panel. We've talked about it at the planning. Housing is a big issue. That is something that is really a problem for people and where do they live. I could give you examples of my own family of the difficulties they have. They want to be in this county, they're trying. They're not interested in moving away to make the bigger bucks. They want to stay here, but finding a place that they can afford and afford long-term is a problem for them. And then we get into the whole workforce and summer help, and it's more than what you can handle here. It's a session that needs to be done on its own, I think. So it's not forgotten. It's out there. What's done about it, I don't know. Pardon me?
Is that the focus of any particular group?
Not that I'm aware of right now, but it's, it's on the horizon, and people are discussing it, so I think probably a future session would be in order.
Just following up on that point, the League of Women Voters Leelanau County has a number of working committees, but one is Early Childhood Needs and Services, which kind of addresses the needs of younger families in the community and what is going to allow them to stay here and prosper or attract them. And then this committee was more focused on the needs of the elders in our community. But we encourage anyone who wishes to join either of those committees, and there are a couple other league committees, to do so. And if you wish to learn more about the league, stay for our meeting just to observe. I'd truly like to thank the panel. I think this was very informative, and give them a little round of applause. We are going to take just a very short break, but and members are encouraged to stay, others are also encouraged to stay and observe. I do want to announce that our next forum on June 1st is by our Energy, Natural Resources and Energy Committee, and the topic is food security. What are the impacts of changing climate on sustainable food security? What are mitigations and adaptive strategies now being planned, and what can you do? That's starting here on Wednesday, June 1st at 11:15. There'll be an array of organizations and entities in the hallway talking about their food concerns and offering solutions, followed by a panel. And then on May 26th is our annual dinner and annual meeting. And this year it's at Timberlea Hills. Dinner's at 6 p.m. Our speaker this year is columnist and Michigan radio essayist, I guess that's the word, Jack Lessenberry. So you can purchase tickets or sign up at the entranceway here. There are materials that the committee has brought on senior services issues, so that's at the table. So thank you once again for participating, and just about a 5 to 8 minute break and we'll start our business meeting. Thank you very much.